This is the Hope Not Note podcast,
where we answer your questions and share inspirational stories to fill your soul with hope.
Our mission is to empower hope to those who have been plagued by note.
I'm Dr. Dillon Caswell.
And I'm Brandi.
And we're here to bring you out of the note and into hope.
Welcome back to the Hope Not Note podcast. We are so thrilled that you are tuning in. We have our coffees, we have the sunshine, and we have you, which matters most. And so we're going to dive into our question from Bill. Bill says, I've been experiencing some discomfort in my rhomboid. What can I do to relieve it?
Bill, thank you for the question. I have a lot of thoughts on this one. I'm trying to
Mr. Physio man
figure out how to directly deliver it. And I think I'll start with one. Sorry that you're dealing with that. Like any type of pain or discomfort is not a fun process, but there's a lot to learn in the process. One thing that we can learn from this, right, and we've talked about it a little bit before, is that the brain works by prediction. And oftentimes, these symptoms of uncertainty are worse than the symptoms of the condition itself. And once we feel like we have some certainty, then all of a sudden we don't have as big as a pain response or as intense as a pain response anymore. And I think this is what happens in cases like this, where you're feeling shoulder pain, you're not quite sure what it is. I think oftentimes when the shoulder is feeling uncomfortable, our brain immediately goes to torn rotator cuff or torn rotor cuff from what I've heard many times. But it's like, that's the common thing that people know. And the reason is because, well, there's some fear around a torn rotator cuff. Like, dang, does this mean I need to have surgery? Does this mean I'm out of work? Does this mean I'm not able to throw a ball anymore? What does this look like for the rest of my life if I have a torn rotator cuff? So it gets kind of scary. But then you go in and you go through an assessment and all of a sudden it's like, hey, it's not your rotator cuff, it's a rhomboid. Whoa, I've never heard of a rhomboid before. Like, what is a rhomboid? I didn't even know my body had a thing called a rhomboid. Well, yeah, it's this muscle in the shoulder that not a lot of people talk about. It's one in the shoulder that not a lot of people pay attention to. And yeah, with your symptoms, it's your rhomboid that's causing this. So where I'm going with this is that we will never know if it's the rhomboid that's causing discomfort, because why would you have a muscular discomfort, right? From straining that muscle or from injuring the tendon associated with that muscle. And in order for us to say that it was this muscle that is causing the discomfort because it's either overused or it could be deconditioned, those are the two reasons that we'll tend to have a muscle injury. Well, then we have to be able to firmly test that muscle. And the reality is with the rhomboid, we cannot do that. There's a researcher, Joyce Smith, in 2004, that looked at different test positions to see how accurately can we test the rhomboid. And in their testing, they used 3 different test positions. And the one that they found that elicited the most activity from the rhomboid was a manual muscle test of the posterior delt. And when they did that test, they found that you're not able to isolate the rhomboid from the levator scap and from the middle trap. So how do we know that it's the rhomboid that's creating this shoulder pain? We don't. We just know that there's something in the shoulder. Maybe it's along the medial border or the side of the scapula that's near your spine. Maybe there's some soreness along there. And from that, we can say as a group, scapular retractors, maybe you can even get fancy and say the scapular retractors and downward rotators are deconditioned or strained or whatever the case may be. But we have no idea if it's just the rhomboid. You cannot isolate them. Now, the rhomboids can be, and not just the rhomboid, and I said rhomboids, there's a rhomboid major and a rhomboid minor, but there's also a levator scap. And these muscles are innervated by the dorsal scapular nerve. So if there's some type of direct trauma to the dorsal scapular nerve, well, now we can start to say, oh, maybe there's something going on with the rhomboids and the levator scap in this situation. that is very rare
Mm.
that that's going to happen. Very, very, very rare. So that is one instance in which we can say, maybe this is more likely to have the rhomboids associated with it, but we cannot say that your pain is coming because of your rhomboids. Like
Mm.
we cannot do that. And then the last point I'll put in here is that maybe somebody told you this by palpating that area. And if you're listening, like what's palpating? It's feeling with your hands. And a lot of people have this perception that experts in the field are able to feel things with their hands that people cannot see and can do all this crazy thing with their hands. And gosh, the research does not hold up to that. It actually shows that the more that a person is an expert with palpation, and let's say I consider myself an expert in palpation, Brandi considers herself an expert in palpation, and we palpate the same patient, we both come up with different findings.
Mm.
So where is the expertise in that?
Right.
It's not there. The rhomboids, they are deep. They are in closer to the spine, closer to the scapula. The middle traps and the trap as a muscle group sits over the rhomboid. In order for us to feel the rhomboid, we would have to push through the trap
Mm.
to then get to the rhomboid. And guess what? Physiologically, we cannot do that. There's no way we can push through a middle trap to
Mhm.
then get to the rhomboid. And if you press hard enough on any muscle group, it's going to elicit discomfort. So if we get to the middle trap and we say, hey, I'm pushing through this to get down to your rhomboid. Oh, you have discomfort. That's your rhomboid. No, the discomfort is how hard you're pushing to try to get to a muscle that you're not going to get to because just because you push harder, it doesn't mean that your fingers are separating the muscle as you're pushing. And that's just the muscle.
Mhm.
Like, I didn't even mention the skin, the fascial tissue, like how deep you'd have to go. And you'd have to have like lasers on your fingers to separate the muscle to then get into the rhomboid.
Mm.
So, summarizing that, Bill, I know that this is not saying that your discomfort is not real. Your discomfort is there, and we, without doing a full assessment, we don't know why it's there. Um, there's some there's a lot of piriformis syndrome. It's like, oh, I haven't heard of this muscle before. That sounds fancy. Like we could create obturator internus syndrome. Ooh, what's that? Subscapularis syndrome. What's that? Oh, maybe
Mhm.
that's what I have going on. But the certainty in there, it gives the brain a little bit of peace, but it's a false hope framework.
Yeah, I was going to say that, like, just because you label something, it creates a certainty,
Mhm.
right? But it doesn't necessarily need to create a certain certainty, and you don't need to find your certainty within this label. I think we get so caught up in having something to define what we're feeling.
Yep.
And that doesn't even have to be with the rhomboid or with shoulder discomfort. That could be literally in any area of your life. Doesn't even have to be physically. It could be like psychosocial or like mental. Like there's so many different ways that we go about our lives seeking labels to help build certainty and like really comfort in that label. But that's not necessarily needed. What's needed is moving forward. So you don't have to have a label or you don't have to necessarily identify something in order to move forward and to like not feel that discomfort anymore. But I think
Yeah.
people get so caught up in the label that then they don't even get to that next step of
Yeah.
relief, really.
Right. Very, very well said. And in the book, we talk about it in the chapter of labels create progress, labels destroy progress. Like sometimes labels are very helpful. Other times labels just they're not. They
Mhm.
they halt us from moving forward. And the reality is these gold standard tests that we have in sports medicine, orthopedics, physical therapy, they're starting to be challenged as the gold standard because we've advanced. We've learned a lot more, which is super exciting. And the biggest thing that we've learned is we don't need to know exactly what's going on in order for this to get better. And as Brandon was saying, there's all these different levers that we need to look at. At the same time, a lot of people aren't willing to be courageous enough to say, I have some discomfort in my shoulder, but it's likely because I haven't loaded it all year. And then I went out and shoveled for 3 hours and had a lack of sleep. And by the way, I don't really enjoy my job.
Mhm.
Oh, but like, what's going on with your shoulder? Well, that's what's creating my discomfort. Like, no, no,
Right.
no, no. Like, what muscle is it the rotator cuff? Like,
Hmm.
no, it's just I was underloaded and then did a lot of load, and my recovery is just not there. I'm not adapting well. Yeah, but it's got to be a muscle. It's
Right.
got to be there's got to
No.
be something in there. And like it is easier for people to have the conversation of like what's going on with your shoulder. Well, yeah, my rhomboid's jacked up. Whoa, that sounds like that's pretty painful.
Hmm.
Like you don't even know what the rhomboid is. What do you
Right.
mean it sounds painful? It's just a word you haven't heard before.
Never heard of it before this
And again, we can go
podcast.
through the human body, and it's one of my pet peeves with people, and I say this as more of the provider standpoint of making up these things. You have popliteus syndrome. Your knee's not unlocking because the popliteus is tight. How do you know that?
Hmm.
How did you test that? Oh, you palpated a muscle that's super deep on the knee that is behind all the hamstrings, the groin, the fascial tissue. You touched that?
Hmm.
Wow. Like you must have some really sharp nails with some lasers on them. Like
Yeah.
how do you get into that? But again, we can get better moving forward without knowing exactly what's
Hmm.
going on. And how do we do that? Well, it starts with a good assessment, a good subjective evaluation. Hey, what was there any mechanism of injury? Like, oh yeah, I actually got hit really hard in this area. Huh. Well, now I'm thinking that this could be dorsal scapular nerve palsy. So let's identify that. Let's look at that. Oh, there's not a mechanism of injury. Let's start looking at load and workload and load management. So this kind of crept up on you, but has there been any change in activity? Whether it's with your job, did you go back to the gym? Did you randomly bust out a bunch of push-ups because you're feeling super motivated and excited? Like, what was there any change in activity that brought this on physically? Yes. Okay, well, let's dive into that. No. Well, maybe it's something more psychosocial that is going on that your body's trying to protect in that area. So there's a lot of factors that we can look at and start to move that forward. Now, if you're having that medial border of the scapula, kind of like near the spine where the shoulder blade, where they meet each other, if you're having discomfort in that area, well, let's look at again load management. Are you sitting all day and your back is rounded? And then if you're rounding through the day, that means that that area is being put on stretch the entire day. So it might just be sore because of the tension that it's taking throughout the day. How do you help that? Just change your position once in a while throughout the day. Doesn't mean you have to sit perfectly up straight like this all day. Just once in a while, lean back a little bit, get up, maybe rotate around.
Mhm.
So there's
It's similar to like I remember my eye doctor saying, "Oh, you're in front of a computer all day long. Every once an hour, take 20 seconds and look outside the window."
yeah,
It's the same thing. Once an hour, just like do a little stretch, go for a walk,
yeah,
like do
yeah,
something to get moving, but also like open that area up.
just change position.
Hmm.
And then if it's something that's like, oh, this area is deconditioned or deloaded, and I want to work on my scapular retractors, because again, we cannot isolate the rhomboid from the middle trap, from the levator scap, from
Hmm.
other muscles that are working that area. Rows, face pulls, anything pulling is going to be a great movement
Hmm.
to get to that area. And then it's just adjusting the parameters around
Right.
it.
Yeah, don't dive in and go and do like a what do people do on the rowing machine? They'll go do like a 2000
Right.
row. Like, don't do that right away. Like, definitely ease into it. But if that's what you're looking to grow in,
Yeah.
then take like the necessary steps, but like obviously progressive overload while doing it.
Right. Yep.
Hmm.
So, Bill, I hope that answers your question and gives you a little bit of direction, not to bring you back into the uncertainty, but more to make sure that you're not perseverating on this one muscle group and thinking that
Hmm.
the rhomboid is the sole issue of this, because again, that's a false hope framework. And we don't want you to have that. We want to be able to address it so that you can do what is needed for you to get back
Hmm.
into whatever activity it is that you want to get back into.
Yeah, and I also encourage you, Bill, and anyone listening, when you're having discomfort in, your shoulder or your knee or wherever you're having discomfort, don't like disassociate from that specific area of your body. Dylan and I talk about it all the time. I think you may have even wrote it in the book where
Mhm.
it's like, why is it that someone who's having discomfort in an area of a body, you ask them, how are you doing? They say good. But then when you ask, oh, how's your shoulder doing? Oh, terrible. Like, why are we disassociating from that movement? Like, remember that, like, that part of your body is there and it's good. And like making sure that you have like the proper dialogue around it is going to, create safety and create relief to that area, as if you're not calling it bad all the time.
Yeah. Yeah.
Cool.
Nailed it.
Nailed it. All right, Bill, we hope that's helpful. We're going to dive into hope stories. Do you want to kick us off?
Yeah, I'll start with the hope story. So this one is they're all personal hope stories, but this one is about me.
All right. All right, Mr. Hope Story
We'll go with
Man.
that. So recently was doing a online qualifier for a CrossFit competition, and was excited to do it just because competition, you get to push yourself a little bit and see where you're at. And it was what, 4 weeks, 5 different workouts. And not one time did I look at the leaderboard
Yeah.
throughout the entire process because I didn't want to associate my outcome with the number on the leaderboard. And we talked about it before on the podcast, that disassociating from the number and associating to the outcome that you're after. And I didn't look at the leaderboard because if I was up high on the leaderboard, I didn't want to take my foot off the gas pedal. If I was lower on the leaderboard, I didn't want to get discouraged in that. And I also wanted to see, will I push myself the same if I don't know where I'm at on a leaderboard? And I can very happily say that I did. Because the last workout, I ended up doing it 3 different times because I was like, oh, if I go with a little bit different of a strategy, I might be able to improve my score a little bit. If I pace this part different, can go harder in this area, and did it. And I was like, okay, that one didn't get a new score. That was better. So let's try it this way. And repeating it twice, like, did not do any better, but was able to kind of practice and see, like, hey, if I pace here differently, what will happen, which was fun. That workout had a lot of double unders in it. It's like jumping and the rope swings underneath your feet twice in the one jump. And so my calves were sore for like 4 or 5 days,
Yeah.
a week after it. But I was really excited that I was able to do the competition and push, keep my foot on the gas pedal. And at the end of it, when I saw where I was on the leaderboard, not being discouraged or encouraged, but just being excited that I did the best that I could do. And, as a qualifier to go to the in-person competition, and I didn't make it to that in-person competition. It's incredibly competitive. The people that are making it were just like, I looked at their scores and I'm like, are you kidding me? But it didn't take away from how excited I was with the effort that I put in. And the only reason I'm sharing that is because maybe someone needed to hear that. Maybe someone's been so tied into a leaderboard that they forgot to, one, enjoy the process, and two, that like that's a number on a board. That does it have some meaning? Yeah, it means that you get to go to the next step or not, but it doesn't show the work that you've put in for that. So,
well, thank you for sharing that, because I know that people listening, especially in the CrossFit world, are going to relate to that. But I also want to encourage them with my hope story, because it just inspired me that Dillon, was prepping for this online competition. At the time, like, I had a competition in June and I haven't really had one since. And I did not sign up for this one, but I did most of the workouts to the higher scaled available, because I wanted to see, like, if I was close to being in that division. And for some, I was kind of close, but for the most part, like, I'm still in between and working hard. But in our training outside of this competition, we have been working on a lot of our limiting factors, which is important to do, especially when you're competing. I think in general, but especially when you're like competing with a goal, it's good to like get your limiting factors. Anyways, all that to say, Dillon and I, more so Dillon, did this whole new what's it called? Competition. Sorry. Dillon did this new competition. I kind of did it, but not really. Like, I didn't sign up for it. But then a week after, we both PR'd our front squat.
Yeah.
you know? And
Yeah.
so like my hope story is that, and we hadn't really been training our front squat. I kind of was, but I was not training the like heaviness of it or the
Yeah.
load of it. I was training like keeping my elbows up because it's a struggle of mine. And so I was doing a lot more of like pausing front squats more than anything. Where you haven't been squatting like hardly at all other than like maybe wall balls and stuff. You've been doing more um like lunging and stuff like that. And so then when we both like got our personal best of our front squat not even a week after this like competition, it was really just a huge victory in the Caswell house for our fitness side of things.
Yeah. And these are lifetime PRs,
Yes,
not just
yeah.
like a PR for the year, but like lifetime PRs,
Hmm.
which like was awesome because it was also after we already did a workout
Hmm.
and it was just like, hey, we haven't been under a heavy bar in a while. We should get under a heavy
Yeah.
bar for whatever heavy is for that day. And heavy for that day ended up being 105% of
Yeah.
our previous one rep maxes, which was pretty freaking
Yeah,
awesome.
it was really cool. So big victory in the lifting department.
Yeah,
Yeah.
big wins.
Yes.
Yeah.
Thanks for listening, y'all.
Thanks for listening. Have a great week and remember, every day is not just a day to be hopeful, but an opportunity to become hope.
The Hope Not Know podcast is meant for educational, informational, and personal development purposes only and does not constitute any health or medical advice. If you're looking for specific advice, connect with us to work with a Hope coach. The Hope Not Know podcast shall not be liable or responsible for any loss or damage allegedly arising from any information or suggestions in this podcast.